What's up, dog? This is Dr. CJ, aka Corey, aka Chocolate Thunder, and welcome to Medical Things and Stuff. This is Dom.
And we're the Puppets! I'm Jimmy.
I'm Naomi. And I'm Grandma Rose.
Wow! What a beautiful day outside, Grandma Rose.
Yes, child. Ouch, my hips hurt and so do my shoulders.
Grandma Rose, are you okay?
No, son. This has been going on for a while now. It just takes me a while to get out of bed in the morning and get going with my day, you know?
No, I don't know, because I love waking up in the morning because I get to see Naomi.
Hey guys, what's up?
Hey Naomi, I was just talking to my grandma here about all this pain she's having. It's in her shoulders and her hips.
What's wrong with you, Grandma Rose? I have Polymyalgia Rheumatica. What?
Yeah, I have no idea, dude. Not in my vocabulary.
I knew this would happen. Luckily, I have this special wand that makes PTs appear when you need someone else to explain your diagnosis. Like a good neighbor, PTs are there.
Hey. How are you doing, Grandma Rose?
Does someone need to know what polymyalgia rheumatica is?
Polymyalgia rheumatica is an inflammatory disease that's common with muscle pain, stiffness, and aching, and it's most common in the shoulder girdle and hips.
Oh no! How did Grandma get that?
Well, that's a good old question there, Jimbree. So, currently the exact cause is unknown, but research suggests that it could be due to a genetic link, environmental factors, or possibly inflammation of the bursa.
If you don't know how Grandma got it, then how do you know that's what she has?
Well, there are many ways that the doctors can diagnose this disease. Overall, it's present in about 2% of women in their lifetime and 1.7% of men. Diagnosing this disease is by the use of radiographs and bone scans to see the bones inside your body. These images will show a common pattern of inflammation in the joints of the shoulder and pelvic girdle. Now over to Dr. Dunkenstein.
Shoulder, pelvic girdle.
Several risk factors are also taken into consideration. For example, being over the age of 50, smoking, sun exposure, and infection. They will also ask about Grandma's past history and pattern. If her joints are stiff in the morning for more than 45 minutes, or she has bilateral aches and pains in her neck, shoulder, and hip, or she has an erythrocyte sedimentation rate of 40 or more. Finally, doctors will look at how quickly symptoms are relieved with low-dose glucocorticoids.
Ah, yes, those corticosteroids. Some friends have warned me about them, and yet my doctor still prescribes me prednisone.
Well, your doctor still will give you prednisone to manage the disease, Grandma, but the dosage will be gradually declined to lower the side effects of the corticosteroids. A higher dosage will be given if someone has a giant cell arteritis or GCA.
Is there a way I can look for things to see if my grandma or grandpa have it too?
Yes, there are other signs and symptoms that will be seen with the clinical presentation. You already know about the pain and stiffness in the morning for long periods of time and the bilateral areas of the body that are affected too. But there are also systemic symptoms such as fatigue, malaise, depression, anorexia, fever, and weight loss. There will also be loss of range of motion in the neck, shoulders, and or the hips. This makes it difficult to move around and to reach overhead, which is very important in daily living.
That sounds so sad and painful. I'm sorry, Grandma. So, how does my grandma get better? Is that why she has the magic wand?
Well, yes, Jimmy, we can help your grandma with her pain, decrease strength, and range of motion. Our role as PTs is to exercise, increase strength, and use stretching and other modalities to increase range of motion. All these will help to reduce pain, swelling, and help her feel better overall. The best part about us, unlike corticosteroids, physical therapy has no negative side effects.
Woo! Yes, but some special implications for us to remember are monitoring for warning signs of GCA, which would be sharp pain on the temporal side of the head. This has been associated with stroke and blindness. Some patients also might feel relief from prednisone really quickly, so you want to make sure that you are reminding them to stay on track with their meds. Lastly, fractures are not uncommon with this disease, so it's important for us to encourage calcium, vitamin D, and exercise to preserve bone health.
Wow, that's a lot of things to consider. PTs are smart.
Yeah, we're smart, but we can also dance.
Hit it. The first red flag,
First red flag.
if they're over 65.
If they're over 65,
They have pain here,
have pain here,
and they can't see here.
and they can't see here.
It might be GCA.
Might be GCA.
Watch out for GCA.
Watch out for GCA.
The second red flag,
Second red flag,
signs and symptoms.
signs and symptoms.
A fracture. Thanks for joining us for medical things and stuff. It's been a pleasure. Doctors will look at how the symptoms of low dose glucocorticoid.
Glucocorticoid?
Glucocorticoid.